Nakitlong ka Ri Khasi. Ngiwan lam siya pi ko sngur bakhuit parpasngam. Ka beats aqua. Shposnem dang yai pinja sliang.
Got your results? Looking for a new course in nursing and paramedical course? Admission open at one of the topmost colleges in the country, East-West Group of Institution Bangalore, recognized by Indian Nursing Council and Rajiv Gandhi University of Health Science. Choose your courses on your screen. Hurry up, limited seats available. For more details, you can contact the link given below. So right now we have another doctor here with us, Dr. Debdeep Samadar. He is an associate consultant, medical oncology at Manipal Hospital, EM Bypass. So doctor, can you please give a brief introduction of yourself to our viewers?
Yeah, hi everyone. So I am Dr. Debdeep Samadar. I am an associate consultant in the Department of Medical Oncology at Manipal Hospital, EM Bypass, Kolkata. So I have done my MBBS and MD from Kolkata, and I have done my DM in Medical Oncology from the prestigious Tata Memorial Hospital, Mumbai. And then after completion of my DM, I have joined as an associate consultant in the Department of Medical Oncology at Manipal Hospital, EM Bypass, Kolkata.
All right, doctor, thank you so much for your introduction. So we have a few questions here for you. So the first question is, cancer treatment has advanced significantly in recent years. How have newer therapies and developments in medical oncology changed the way cancers are managed today?
Yeah, so if we'll talk about the development of medical oncology, earlier, like 25 years back, the treatment of cancer solely, from medical oncology, it solely depend on chemotherapy. But with years, it has changed in two paradigm. One is from diagnostic point of view and one is from therapeutic point of view. So from diagnostic, we have pretty newer modalities of investigations which have more personalized the cancer treatment, and in terms of molecular testing, genetic testing. And the second thing, we have more development in precision medicine in terms of targeted therapy and immunotherapy. The targeted therapy and immunotherapies are more precise action. They have less side effects, more response rate, and better outcome.
Okay. All right, doctor. So we have another question for you. Many patients associate a cancer diagnosis with fear and uncertainty. How important is early detection and timely medication intervention in improving treatment outcomes?
Yeah, so I think the early detection remains the key in the management of cancer.
Yes.
Because if we can detect early most of the patients, then we will put across in the natural course of cancer, and those patients can be treated with chemotherapy, surgery, or radiation, and there is a long-term chance for cure for those patients. But unfortunately, because of lack of awareness and because of delayed diagnosis, because of multiple logistics issues, we get a lot of patients in stage 4 cancer. Now, unfortunately, for those patients, we literally have, we can't do anything without, we can't cure them. We can only give chemotherapy or any forms of treatment just to prolong their life. Okay. So you can understand, if I'll get a same cancer patients in stage 1 versus a same cancer patients in stage 4, there is a huge difference in outcome. Only if it's stage 1 or stage 2, I can do a surgery and there is a long-term chance for survival. Okay. But on the other hand, if the patient directly comes to me in a stage 4 disease, in most of the cases, we can't able to cure them. We can only improve their quality of life, and we can only prolong their life maybe some months to years.
Yes.
So that's why early detection remains the most critical and most important step in curing cancer.
So doctor, what I've learned today is that from the past 2 interviews that I've taken, the only thing I've learned is that the earlier the better.
Yeah,
it's not.
it's
All right. So the third question is, what are some of the common cancers you see in patients from the Northeast region, and what factors contribute to their increasing prevalence?
Yeah, so in my practice in last few years, so when I was in Tata Memorial Hospital, Bombay, and followed by I recently came in Manipal Hospital, Kolkata. So we used to get a lot of Northeast patients with some typical cancers, like they usually have more chance of squamous cell carcinoma of head neck region. They have nasopharyngeal cancer. They have hepatocellular cancer and they have esophageal and stomach cancer. These are pretty common, and I mean, it's very difficult to tell you the exact numbers, but what we understand that this cancer's incidence or prevalence is much higher compared to other parts of the country, particularly the cancers I have talked about. Now, coming to the factors that may contribute, or we have certain factors which I mean, I think everyone will agree that these are preventable, in forms of diet and habit. So I believe ki, chewing tobacco, use of betel nuts, alcohol, and also smoked food. These are some important contributors which have, proven role in carcinogenesis.
Okay, all right, doctor. Thank you so much for that information. Moving on to another question, doctor. Medical oncology includes treatments such as chemotherapy, targeted therapy, and immunotherapy. How do these approaches work, and how are treatment plans personalized for patients?
Yeah, so if you talk about medical oncology, there is a huge development in recent I'll say last 20 to 25 years. So earlier, when like 50-60 years back, when we used to give some medicines to kill cancers, it's a conventional chemotherapy. Now conventional chemotherapy are some cancer drugs which we give either through injection or through tablet, and they goes in our body and they kill the cancer cell. But the main problem of chemotherapy is that their actions are not specific to the cancer cells. They have a wide spectrum of action in the normal part of our body. So we can understand, if you give a chemotherapy, the same way it kills the cancer, the same way it will cause side effects to a normal part of body. So patients will have a longer time to recover, and also sometimes these side effects can be fatal. They can be life threatening. Now coming to the second is immunotherapy and targeted therapy. So targeted therapy is also a very newer modality. Now by personalized medicine in recent few years, we are able to identify certain genes or certain mutations which are causing cancer to a particular patient. Like if in this room there are 5 patients who are having breast cancer, the 5 breast cancer will different in a 5 way, not the same way. So there are many tests coming nowadays or already existing which have a role that they can identify that particular genetic alteration to that patient, and according to that you can target this by certain medicines. So the good part of targeted therapy is that we know that we are hitting the right zone. So there is a much more response rate, much better outcome with targeted therapy. Now coming to the immunotherapy, I think in last 4 or 5 years we have all gone through this term of immunotherapy, which is the most newermost modality in terms of medical oncology. Now immunity is a primitive form of defense mechanism of our body which acts against infection. Like when we have an infection, our immune system get boosted and they kill the infection. At the same way, the science have evolved in such a way that we can identify certain medicines which if we give in our body, they will boost our immunity.
Okay.
And this immunity will act against cancer.
Okay.
So now the good part of immunotherapy is in last 2-3 years it has shown a beautiful response in stage 4 as well as early stage cancers in solid tumor as well as hematolymphoid malignancies. And also their outcome and response rate are much better, and very frankly speaking they are very less side effects. They're all daycare procedures. Patients do their normal daycare job, their normal life. They maintain a very good quality of life, and at the same time they come thrice or twice or once in a month, and they take chemotherapy on a immunotherapy daycare basis, and they go. So you can understand it's not only because of because cure, but at the same time to maintain a good quality of life. And the third thing that those patients who got survived cancer, we have seen in a long run, like 10-15 years down the line, these patients are more prone to develop other disorders like metabolic syndrome, like diabetes, hypertension, cardiac comorbidity. Now this is much less with when I'm talking about immunotherapy or targeted therapy.
Okay, that is quite interesting and very knowledgeable as well. So we have another question. What role do lifestyle changes, regular health checkups, and awareness plays in preventing cancer and identifying it at an early stage?
Yeah, so first I'll talk about habits. So there are certain cancers which depends on your addiction. Like as I already mentioned, like use of tobacco, alcohol, betel nuts. They've known to cause certain cancers. So obviously the first answer is say no to all these things. Obviously a healthy lifestyle, a healthy fit lifestyle will not only have a good or beneficial effect over cancer, over many other diseases. So obviously we should maintain a healthy lifestyle. And your third question was sorry.
And what role does it play in preventing cancer and identifying it at an early stage?
Yeah, so the second thing is general awareness. I really think general people should have much more awareness about the basic symptoms of cancer. We find a lot of patients having a breast lump for 7, 8, 10 years, and then they're coming to us with when we can't literally do anything. So if we have a basic awareness at a community level, people should know these are my alarming signs. Like if I have a lump in my breast, or if I have a tumor in my, or a swelling in my mouth, or a abnormal bleeding from any of the natural orifice of our body, we should visit a doctor. So obviously general awareness is very important, because I think still most of the people are not aware about the basic symptoms of cancer.
Right. Okay. Yes, awareness is pretty much important, especially like not only in a certain area. It is very much important in all over the states of India.
True.
Okay, coming to another question, doctor. This will be the last question. For cancer patients and families seeking treatment, what advice would you like to share about managing the journey, maintaining hope, and accessing advanced care at the right time?
Yeah, so the first thing is, earlier we used to say, people used to have a myth that cancer means it's a death. It's an overwhelming thing for the patient and the entire family. So I just want to say that there is a huge advancement in cancer in every aspect, like in radiation oncology, surgical oncology, medical oncology, and as long as the diagnoses are concerned. So, I just want to tell them, don't think that cancer is equal to death. There are different stages of cancer when it is get diagnosed. So you go early, seek medical help, take advice, ask questions to your caregiver, and ask question to your primary healthcare physician. Take a shared decision, and if we detect early, if we treat early, there is a huge chance of cure. And the places where we can't able to cure, there are a lot of stage 4 cancer which have a survival of more than 5 years. If you treat 100 patients, 50 patients will live more than 5 years, even in a stage 4 cancer. So there are a lot of advancements. So don't think there are certain stage 4 cancer also has become a chronic disease. Like in a diabetes, you take medicine throughout your life. In cancer also, you take medicines and you do everything you do. So I think it's just be strong, go to your healthcare physician, take advice, do whatever he's saying. It's a combined and shared thing to do. Don't lose your hope. It's really a myth now that cancer is just the other name of death. No, not at all.
All right. Okay, thank you so much, doctor. It has been very informative and very knowledgeable as well, knowing about the symptoms and what measures to be taken to treat cancer. It was very interesting to have you here with us. Thank you so much, doctor. Thank you.
Lily, Pikalan.
Kanda pitrai kami kabisa. Balik itu na adu kami.
Kenambay kami kami.
Mana bawan kata baci? Kau lawan. Lawan Kumno. Ila kham stom menta.
Bila su palan. Wan num dan Jingtieng ni ai. Menta tu penhiar mensiam suki bat ngamo.
Kali jong na ni. Ba, ka hospital te kala ajngai nang ni. Kabai kali pan.
Kabai kali latip ke sarkar.
Pintia shua hang ni hadu nda de por kamu.
Wat ko selaitan.
Ba kan dekat skim kalaya rap cibun ya kilong yang kum jong pi.
Shim kanay ka bam. Kublay shibun sista. Ngiran ka man siwi ay.
Yang perlu kalau dihika sarkar.
Kublay shibun. Iladan ako siya kakababyang.
Ke sarkar ajarap ikit kiba ablang.
Kublay shibun.
Sister, hapsiu kat nama.
Kasurkar kala siulat ikijingnut jing separo.
Kabli sipuan ma.
Ngiki pakardo ngampoi perkat banyo kum kani kajing yarap. Hawat kan?
Kanika Chief Minister Safe Motherhood Scheme. Kalau ai jing rap yang isibon bah kipat ba.